So recent research does confirm that daily small choices can have a very important impact on our health. According to many studies, you can reduce your risk of adult cancers by as much as 20% by eating more meat and beans, fruits and vegetables, dairy products, or simple carbohydrates. Fruits and vegetables. You know, I always tell folks too, when you're doing your grocery shopping, if you tend to shop on the perimeter of the stores, when you go in and it's the beautiful produce section, you know, and then you have the dairy and the lean chicken and turkey and fish and that's where all of the better choices are. All the interior of the store, where everything is always packaged and processed, the more it's packaged or processed, the less good it is for you. This is just kind of a fun comic with Adam, and it's not necessarily putting strawberry rhubarb in a waffle cone. So what is the single most important thing that you can do from a nutritional standpoint? What we would like you to concentrate on is what we call eating a more plant-based diet. A plant-based diet means that you're getting more vegetables, more fruits, more whole grains, and that would be whole wheat or whole grain bread, brown rice instead of white rice, whole wheat pastas, or at least the wheat blends of pastas, and whole grain cereals. Certainly legumes would include beans, peas, and lentils. So why are these plant foods so good for you? Well, what they have in them are the phytochemicals and antioxidants. And these are the compounds that we're discovering that help protect against heart disease and cancer by reducing inflammation, inhibiting blood clots, and preventing oxidation. So the easy way to remember phytochemicals is just with the word phyte. It means disease-fighting plant chemicals that naturally occur in plants. The antioxidants that are also in the fruits and vegetables and fiber-filled foods help protect your cells from damage, if you think about it kind of like rust-proofing the body. This is kind of a fun comic too. I think a lot of people have heard that blueberries are very high in antioxidants, and so actually it is one of the highest, best fruits that you can eat. There are more than 4,000 phytochemicals that have been identified, and there are likely thousands more yet to be discovered. What we try to emphasize is choosing deeply colored foods whenever you can, or try to eat a rainbow of colors on a daily basis. I'll often share with our patients that the deeper, the darker the color, typically the better it is for you. Taking that a step further, what you want to do is you want to combine your colors. So I'll explain, say you were to have broccoli and strawberries at the same meal or same snack or whatever. The compounds that make the broccoli a deep dark green are different from what makes a strawberry red. But when you ingest them together, those phytochemicals and antioxidants, they communicate back and forth, and that's what they find to be tumor protective. It's this synergistic effect that occurs. So it's not just eating more of them. I think people get tired of hearing that message, oh, I know I should eat more fruits and vegetables. We want you to eat more, but we want you to combine your colors, okay? So how much color is in your diet on a daily basis? Certainly with the blues and the purples, that would be things like blueberries, blackberries, the grapes, plums, eggplant, purple endive. And obviously in Michigan, when things are not always in season, you can certainly buy them in a frozen form and put them in smoothies or any way that you can get them in. Certainly green colored foods would include avocados, broccoli, dark leafy greens. I always encourage people not to eat iceberg lettuce, to try to eat more spinach and romaine and radicchio and things like that when you do your salads. Green apples, green grapes, kiwi, asparagus, Brussels sprouts. And actually with Brussels sprouts and broccoli, those are what we consider cruciferous vegetables. And they keep doing more research on those vegetables in particular, which also includes cabbage and kale and cauliflower, because of all the benefits that they're seeing in terms of cancer protection. Certainly yellow foods would include grapefruit, lemons, pineapple, yellow peppers, summer squash. We've seen a lot of orange colors with fall, with the pumpkin and squashes and sweet potatoes and oranges. And then, of course, there's the beautiful red type foods that we can have, the apples, the cherries, the strawberries, beets, red cabbage, radicchio, tomatoes. Just remember, it's not always what you are eating, it's what you are not eating that can make a big difference. If the only change that people made was to eat at least 5 servings of fruits and vegetables each day, cancer rates could drop by as much as 20%. So then folks will ask us, well, does that mean I need to be a vegetarian? No. The findings indicate that diets that are high in fruits and vegetables that also include modest amounts of meat are just as protective against cancer as vegetarian ones. A good guideline is to limit your serving of meat to 3 ounces or less per day. That's about the size of a deck of cards. And I have this plate that you might want to look at afterwards too, that we'll kind of review. But this would be about the size of a piece of, like a chicken breast or a piece of fish. So again, if you look at the palm of your hand or the size of a deck of cards, that's about the size serving that you would want to have. So with the American Institute for Cancer Research, they've given us a very easy way to think about how our plates should be configured. What we want to focus on is 2/3 or more of your plate being filled with vegetables, fruits, whole grains, and beans. And then only about 1/3 of your plate should have the animal protein. Now, this is actually a world-renowned report by the World Cancer Research Fund and the AICR, the American Institute for Cancer Research. And it was titled Food, Nutrition, Physical Activity, and the Prevention of Cancer, A Global Perspective. This was a series of studies that were looked at, over 7,000 actually, on diet, physical activity, and being overweight in relation to cancer risk. Out of these came our recommendations for cancer prevention. Number 1, certainly, is to be as lean as possible as you can without becoming overweight and without becoming too underweight. Certainly, trying to be physically active for at least 30 minutes every day. Limit the consumption of energy-dense foods, your high sugar, high fat, low fiber processed foods. Try to avoid sugary drinks. Eat mostly plant-based foods. Limit your red meat and avoid processed meats. Limit alcohol. Watch salty type foods and adding salt. Don't use supplements to protect against cancer. And then the last one for cancer survivors is to follow the recommendations for cancer prevention. So a diet based mostly on vegetables, fruits, whole grains, and beans can help prevent cancer, heart disease, type 2 diabetes, and stroke. And certainly it can also help your weight maintain in a healthy range. So what is the key in terms of servings in that? Well, an easy way to think about it is to try to have at least 2 cups of fruit and 2 to 3 cups or more of brightly colored vegetables per day. That is what is recommended to try to help prevent and to aid with recurrence. So again, vary your veggies. Try to eat more dark green vegetables. Try to eat more orange vegetables. Certainly a sweet potato is always more beneficial for you than a white potato. Try to eat more dry beans and peas and pinto beans and kidney beans and lentils.